Do you have hair that you don't want, like whiskers? It's super common in PCOS. It's called hirsutism. Let's talk about effective treatment for unwanted hair. Dealing with hirsutism can be really hard, but it's possible to stop the abnormal hair growth if you understand how your hormones work. Hirsutism and PCOS is something we talk a lot about in our hormone support group, which is free, by the way, and I'll put the link down below. So what is hirsutism? Hirsutism is male pattern body and facial hair in women, and it's a common symptom of polycystic ovary syndrome, or PCOS. This male pattern hair growth happens because your body makes too much male hormone. In PCOS, it's from an overproduction of DHEA, which gets converted to testosterone. But it's not testosterone that's the problem. It's DHT, or dihydrotestosterone, that stimulates unwanted hair growth. So if you want to get rid of the facial and chest hair, you must first balance your hormones. Estrogen helps to stimulate sex hormone-binding globulin, which binds testosterone. If your male hormone is high from too much adrenal DHEA production, it's hard for your ovaries to make enough estrogen to bind up all that extra testosterone. Supporting your hypothalamus, which is the boss of all your hormones, helps your body naturally get your female and male hormones back into balance. Losing extra belly fat caused by insulin resistance, which is common in women with PCOS, can help balance your hormones too. In some cases, estrogenic herbs can be helpful, but be careful, as women with PCOS tend to have more estrogen than progesterone, and estrogenic herbs may make your imbalance worse. Foods that help enhance safe estrogen metabolism, like flax, fish oil, and cruciferous vegetables, can help reduce testosterone. If you don't balance your hormones, you'll be fighting a never-ending battle with your whiskers. Now, second, you need to block DHT. Dihydrotestosterone is the most potent male hormone, and women with hirsutism tend to have much too much of it. DHT stimulates male pattern hair growth on the face and the chest, even hairy arms and legs, as well as male pattern baldness. Now, 5-alpha reductase inhibitors are often prescribed to block DHT, but these drugs can have significant side effects, especially for pregnant women. If you're carrying a male fetus, the baby's genitalia will not develop properly. A natural DHT blocker is called saw palmetto, an herb used for men to block DHT, which helps to shrink their enlarged prostates. Saw palmetto can work well for women too, to block DHT and prevent further unwanted hair growth. Now last, you can begin to remove the unwanted hair. There are a few effective hair removal techniques like laser and electrolysis, but until you balance your hormones and block DHT first, the unwanted hair will continue to grow. So before investing in expensive, time-consuming hair removal procedures, get your hormones back in balance. One of the best ways to lower your male hormone to reduce hirsutism is to eat a healthy plant-based diet. I like to recommend the Mediterranean diet, as it's easy to follow, rich in healthy fats, and lots of colorful vegetables, which help you metabolize your hormones safely. Avoiding processed foods is key to keeping hirsutism-causing male hormone levels down. Now, if you're struggling with hirsutism, please consider supporting your hypothalamus. You'll learn more about how in our hormone reboot training, where you'll also learn about how to deal with PCOS naturally. For more great women's health tips, check out what I've got for you in the next video.